Thank you all to the witnesses who are here and for your heroic work and for your service to our country during this public health emergency. I appreciate that you are taking the lessons learned through this unprecedented experience and are applying them to future pandemic responses. Lessons learned means things that we must take a look at the things that we did well and then the things that need improvement. And we need to be honest in the scope and the proportionality of those good works and the things that need improvement as well. For example, let me remind everybody that we have lost 1 million people in 1 million of our citizens, residents, mostly our most vulnerable individuals. But at the same time, we saved 3.2+ million lives with the efforts that were done. We must look at why our nation had the highest death rates than any other nation and tackle those difficult questions in order to prevent that from happening. One thing for sure is that this pandemic shined a spotlight on what we already know, which is that there are glaring disparities in access to healthcare based on where a person lives, color of their skin, zip code, or how much money they make. And so for those who live perhaps in safer areas with the resources to stay safer, the issue of the pandemic may not have been a high risk for them, and they are mostly concerned of the enormous inconvenience that this pandemic unfortunately gave to everybody. But if you're living in a very concentrated household with people who are sick and don't have access to health care, and you know that the risk is much higher in your community, then the precautions that the CDC and other experts are saying is life-saving. And so that is why this is so important, because we must understand in the public health world, as a physician, you must ask the question, who are the most vulnerable, the most likely to die, and how are you going to prevent them from dying? But it seems like our approach here is very malaligned, and we need to really understand this issue. In my district, for example, the Coachella Valley Volunteers in Medicine and the Desert Healthcare District in Southern California work to address these issues to run testing sites and vaccine clinics in the least served areas of the community, the hardest hit, hardest to reach, for the homeless under the bridges, for the farm workers in the workplaces, for the most vulnerable uninsured at their churches. We took care to the people, and it helped. Together with my office and even myself rolling up my sleeve, inoculating, conducting the testing in Spanish and English, we met people where they were, reducing barriers that people often face in getting the care that they need, like a lack of transportation, the ability to take time off of work. And I applaud the Biden administration for implementing programs to help level the playing field through the HRSA and the CDC programs that distributed vaccines directly to our community health centers and the retail pharmacies who service the very communities that traditionally have lower access to care. And this was a response because of governors who did not follow the equity rule, did not believe in this approach, and did not allow the monies to go to the hardest to reach areas. As a member of this committee and as the ranking member of the Select Committee on the Coronavirus Pandemic, I truly want to understand what we have learned about best practices in addressing inequities and how the agencies here today are applying those lessons to close the gap in our pandemic response and ensure equal access to care for all. Dr. Walensky, what did the CDC learn about the tools needed to address health disparities in the COVID-19 response, and how is CDC incorporating these lessons into a strategic reorganization to make equity a strategic part of our effort in future healthcare pandemics?
Thank you, Dr. Ruiz. You note what we learned in COVID-19, but what we've known in infectious diseases all along, which is infectious diseases go to the most vulnerable. That is how they work, and that is how they, it happens in HIV, it happens in hepatitis C, it happened in COVID-19, it happens in influenza. We knew that that was going to be the case, and we immediately put out resources once we had them in order to address exactly as you did. Go to the community-based organizations, go to those trusted messengers, make sure you have crossed the divides where people might not be reached, because we know that it's going to be the elderly, the vulnerable, those in multi-generational households, those who, when you say you should isolate, actually don't have any place to isolate to. Right? And so that was the work of CDC. We have developed 8 weeks after I came into office, I declared racism a serious public health threat. We developed an Office of Equity. That Equity Office now in our reorganization announced 2 weeks ago will be reporting immediately into the immediate office of the director. And we're looking forward to continuing those efforts to address equity issues. Thank you.
Gentleman yields back. Now recognize the gentleman from Indiana, Mr. Bouchon, Dr. Bouchon.
Thank you, Mr. Chairman. I want to start by saying to all of our witnesses, I appreciate you being here, and I know your jobs are very difficult. The last 3 years have proven a rough time to work on public health issues. And while I believe most public health officials work in good faith, including you all, I also believe that you and your predecessors have at various times been pressured by your respective White Houses to take certain actions or make certain statements in order to achieve political objectives. Again, previous, current, and I just want to say that I cannot understate my disapproval for such behavior. It's so important that our public health agencies be places of science and transparency, and if they are not, the American people find out, trust is destroyed, and then what reason do citizens have to listen to further advice? So we all need to work together to reestablish the trust in our public health agencies. Dr. Walensky, I'd like to discuss one aspect as it relates to vaccine mandates. I want to make it clear, I support vaccination. I'm personally vaccinated, as is my family. That said, I strongly believe that any medical decision, medical therapy, is the decision of an individual and not of the federal government. Beginning in 2021, vaccine mandates were imposed across the country, and as a result of these mandates, unvaccinated people were fired from jobs, excluded from higher education, even denied organ transplants, and punished by judges in probate hearings and child custody cases. And finally, many were kicked out of our military. The prevailing argument for the mandate was this: the more people that got vaccinated, the less the virus would spread. It's my understanding that from the start, the vaccine manufacturers provided evidence that vaccines were safe and effective at reducing the severity of infections, but from the start, they did not provide evidence that COVID-19 vaccines provide sterilizing immunity, preventing transmission of the virus. Is that correct, Dr. Walensky?
Yeah, let's just, so the clinical trials actually did not have an endpoint on transmission, but ultimately through both the wild type and the alpha variant, there were data that were released in the New England Journal that demonstrated that they did prevent forward transmission for the wild type and alpha variant.
Yeah, and you said that earlier in the hearing. The question is when did that happen? What was the date that that happened? Do you
I
know?
couldn't give you the date of the New England Journal piece, but I could tell you that by the time we saw Delta at the end of July of 2022, we knew that transmission.
Because in 2021, March 2020, you said vaccinated people do not carry the virus and don't get sick. That was based on previous information. That's what you're saying. It was an evolving situation.
That was based on the wild type and alpha, yes.
Okay, so that clarifies why the CDC said what they said at that time, I guess. And so I'd like to really know specifically when the CDC knew that vaccines did not prevent transmission, how early in the process. And the reason this is important, and I know you said that you don't know the exact dates of the article and all that, but you know, the CDC continued to support vaccine mandates throughout all this and still do, even though we have knowledge now that although they're very effective, again, I've been vaccinated, I wish everyone to get vaccinated, that they don't prevent transmission, at least the current variants. So why mandates? And the FDA can answer that question too.
Yeah, so maybe I do want to correct. It was July of 2021, not July of 2022, but it was after the New England Journal piece that you're speaking about.
Okay.
I do appreciate you're actually emphasizing the importance of vaccines and how they prevent severe disease and death.
So I have a limited amount of time. So on the last question, you know, with that information, why does currently we still recommend mandates?
You know, my job at the CDC is to provide the scientific data that demonstrates the safety, efficacy of these vaccines in preventing severe
Okay,
disease.
fair enough. And I saw you.
It's a
It's
larger
basically
policy puzzle.
It's basically policy driven, probably from the White House. And you know, the White House says their executive order requiring COVID-19 vaccination for travelers to the U.S. is based on CDC's advice. But what you're telling me that you've given them advice, and they're quoting you and saying that they're maintaining this vaccine for people to come in, even though we've just now discussed the fact that we know that it doesn't prevent transmission. It'll prevent the individual from getting really sick, but it doesn't prevent the risk of someone coming into the country and spreading it to other people.
As well. So it does prevent severe disease and death. It doesn't prevent transmission as well as it did for prior variants, but it does still prevent some. I'd like to offer.
So I'm out of time, but we need to lift this mandate on travelers. It has a big impact on our tourism industry, and most other countries are doing it. I'll yield back.
Gentleman yields back. Now recognize the gentlelady from Michigan, Ms. Dingle.
Thank you, Mr. Chairman, and I want to thank all of our panelists for all of the work that you've been doing under not the easiest of circumstances. And I have a lot of questions, so I need to get to them. But I need to say that we are going backwards on vaccines, and we are building. I hope our hearings do not contribute to the lack of public trust. I look at measles, which has been in my community because people are afraid to get it. And I say this as someone who got Guillain-Barré from the swine flu shot and was more afraid of anybody in the Congress of the COVID flu shot. But I did my research, I got it, I didn't die, and I got every other one. So we need to make sure that we understand vaccinations save lives in all kinds of things as we are doing these hearings. We can ask questions, but let's not contribute to the lack of trust in the community. But since the outbreak of the pandemic, we've encountered new challenges with emerging variants and other diseases. Just this past fall, we saw a triple dynamic with an increase in COVID-19 cases, an earlier than usual flu season, and RSV, which hit children and seniors especially hard. In the midst of this latest challenge, we heard from parents across the country struggling to find common over-the-counter pain relievers, such as Tylenol and Advil for their kids, as well as the antibiotic amoxicillin that's used to treat all kinds of infections. You know, when you're sick and you need it, you get scared when you can't find it. So, Dr. Califf, we know FDA can't wave a magic wand and immediately start producing more drugs when there are supply chain issues. But what can the agency do in a situation like this? What has the agency done to address these shortages? And because we're going to be short on time, what authorities or resources would it be helpful for the FDA to have to better anticipate and deal with these increase in demand and shortages?
Well, as you know, the industry is increasingly developing digitized supply chains. Each company has great detail about its own supply chain, but there is no central hub. And right now, our authorities across drugs, devices, biologics are somewhat different. None of them are as complete as they need to be. Particularly, we need for the companies to notify us when they see a shortage coming, whether it's because of a manufacturing problem, which currently exists for the most part, or because there's a great increase in demand that they're forecasting that will outstrip their ability to manufacture the product. Ultimately, I'd like us to envision 10 years from now a digitized supply chain that could undergo stress testing like we do for banks and the financial sector now.
So, for the record, could you tell us later in writing if there's something Congress needs to be doing to give you more support so we don't have this
Yes,
again?
we'll give you a list.
Thank you.
It gets into details because
I
it's
want
like a
details,
puzzle.
but we'll do it. I think all of us would like to see that. I'd like to now turn to another over-the-counter drug issue. When the pandemic was declared, we saw an increase in demand for another commonly used drug, hand sanitizers. Individuals and hospitals alike were having trouble finding it, and through an enforcement discretion policy, the FDA leaned on the ingenuity of small business owners like local distilleries to start producing product. Other producers, both in and outside of the country, also increased their supply. However, we saw some producers were importing hand sanitizers that have been contaminated with benzene and methanol, known carcinogens and microbiologists that can infect and cause illness. FDA put out statements alerting consumers and asking manufacturers to recall their products, but FDA could not order any manufacturers to take their products off the shelves. Although it may be shocking to many Americans, as it was to me, because unfortunately I bought one of those hand sanitizers, FDA does not have the authority to recall most drugs, even when they're contaminated with these harmful chemicals. Dr. Califf, can you explain how having the authority to actually order a recall would be helpful in times when a product is putting consumers at risk?
Of course, most companies want their products to be good, so they'll recall them on their own. But we run into companies that don't do it and put people at risk. If we can't order it to happen, All we're trying to do is then inform the public about something that can be lethal or cause serious illness. So we really need to have the authority to do it. We wouldn't use it unless we couldn't work it out with the company.
Some in the past have suggested that instead of ordering a recall when a sponsor fails to comply with a voluntary recall, FDA can simply revoke a product's approval or declare the products misbranded. Are these options acceptable substitutes for recall authority? Why or why not?
Absolutely not. Remember that in a recall, you got to go to the shelf and take what's already been there and notify people in their homes. It's not enough to say don't sell anymore. A lot of it's going to be out there in commerce. We have a situation going on outside the U.S. right now, a diethylene glycol in Tylenol and ibuprofen, which is one reason we can't just import it. We've got to have control of the situation.
Thank you. I yield back, Mr. Chairman, but we've got some good areas to work on together.
Thank you very much. The gentlelady yields back. Now recognize the gentleman from Georgia, Mr. Carter, for 5 minutes.
Thank you, Mr. Chairman, and thank you for this hearing, Mr. Chairman. We are committed to a government that's accountable, and we need to be accountable, and so do the agencies, especially the agencies, and especially when we're talking about the government's response to COVID-19 pandemic. The American people deserve, they deserve this information. They deserve answers and accountability, because there have been clear failures by this administration over the past 2 years. We still got existing vaccine and mask mandates that are, and we've experienced diverting funds away from frontline healthcare workers to COVID campaigns. It's no wonder why the American people have lost their trust in our public health institutions. I'm no different from any other member of Congress up here. I have a lot of pride in my state. I'm very proud that the CDC is in my state. But I'm very concerned about the public perception right now of the CDC, especially after what we've been through. That is of concern to me as a native Georgian and as a representative from the state of Georgia. So, Dr. Walensky, I hope that you'll help me with this. But I want to start with Dr. Tabak, because there's something that's very important to me as a healthcare professional, and that is gain-of-function research. I want to ask you, in the fiscal year 2023 omnibus, section 2315, there was a provision included that would ban the funding of HHS dollars towards certain types of research involving pathogens of pandemic potential or biological agents or toxins that are at risk to be a severe threat to public health and safety, effective immediately. This ban is in effect until the agency conducts certain review and oversight of protocol, and it can't be lifted. It cannot be lifted without the appropriate notice to Congress. My interpretation of this provision is that it's a ban of gain-of-function research. And we may have a different definition of gain-of-function research, but I want to ask you, can you please speak to how NIH is implementing this provision?
So we do need to have a short conversation about gain-of-function research. That's a generic term, and it gets us in all sorts of trouble. The type of research that you and everybody is concerned about is a very narrow portion of that, where you take, for example, a virus and attempt to make it more transmissible, you attempt to make it more pathogenic.
Okay, I'll accept that, and I appreciate that answer. That's what this was intended
And
for
we-
in the omnibus.
and-
And that, my question is, are you implementing this?
And we currently are not funding that type of research. We have nothing in that category. The NSABB, which is an advisory committee to the USG, just provided a set of draft recommendations, which will presumably tighten our approach to this type of research. Once the report is finalized, which we expect will occur very shortly, I will send a memorandum to the Secretary of HHS, and he in turn, I presume, will reach out to the NSC and to the OSTP
So what-
to convene a government-wide effort to update the framework with which we work in these.
I want more, I want to hear more than just the effort. This has to be done. So what you're telling me is that it has been done, and it's been done immediately. And I'll accept your limited definition of gain-of-function research.
That is the
Okay,
definition.
then it goes on to say that in the 2023 omnibus, that we ban the funding of pandemic potential research in foreign countries of concern. And we define foreign countries of concern as China, North Korea, Russia, and Iran. Can you tell me, has that been done?
There is no funding of EPP research in any foreign country today. That is sponsored by NIH.
Has there been in the past?
No,
There has not been in the past.
there has not been in the past funded by NIH related to the SARS-CoV virus. Many years ago, there was EPP research conducted in the Netherlands, and that was in influenza.
Okay, let me ask you one other thing. This legislation also mandates that all funding for the research be stopped no later than 60 days after the bill is enacted, and that's the end of the month. Can you commit that your agency will fully comply with the law? Fully comply with law and completely defund any relevant grants at this time?
We have no current grants funded, so there's nothing to defund.
Okay, so I just want to make sure I'm clear. You're not funding anything with your limited definition of gain-of-function research, nor have you in the past. Yes or no?
In the past, there was funding in influenza research, but currently there is no such research funded.
And there will not be in the future.
We have no plans that I am aware of.
Thank you, and I yield back.